Hello, this is Glenn Gruby, and today I'm going to talk about thyroid-related nutrient deficiencies. Generally, it is perceived that it's very difficult, almost impossible, to have an underactive thyroid without some type of a nutrient deficiency. Really, the thyroid is kind of a victim of other problems, whether that be an autoimmune attack or nutrient deficiencies or a stress-induced metabolic problem. And so what we're going to look at today is both some vitamins and nutrients that are necessary for proper thyroid function and also ones that can be negatively impacted when you do have low thyroid function. So let's take a look. First thing we'll talk about is B vitamins, and B vitamins are very important, and especially B vitamins like B6 and B12 and folate can cause a condition that is called elevated homocysteine, and it's an inflammatory marker, and that is linked with hypothyroidism and also causes inflammation in the body. And also folate levels have been linked to low levels of thyroid stimulating hormone. So that's important to have good levels of B vitamins. The next vitamins, A, C, D, and E, are important for production and regulation of thyroid stimulating hormone. Also, vitamin C and E protect against heavy metal toxicity and can partially restore thyroid function when liver detoxification is compromised, and that is important for producing the correct forms of thyroid that your body can use. Zinc is important. It's very common to have zinc deficient in patients with hypothyroidism. And even if the lab levels look okay, if you're zinc deficient, you may not be able to efficiently convert your thyroid hormone into a useful form for the body. And so you may still feel symptoms. So that's important to check. Copper is also important, and they do see this, that thyroid can create low copper levels. And it's also important to note that if you're supplementing with zinc, it's also important to supplement a little bit with copper because you can become depleted if you take too much zinc without copper. It's just a little bit that's needed. The next one is selenium. Selenium is a very important mineral when it comes to thyroid health, mainly because it helps to convert your T4, which is the main form that your thyroid makes of the hormone, into what's called T3, which is what your body uses. And so this conversion can be negatively impacted with a low level of selenium. Next thing I want to look at is iodine, and this is a tricky one. You're going to hear mixed opinions about iodine. Iodine can be a cause of hypothyroidism because it's part of the thyroid hormone molecule. However, they generally agreed that it's not that common in America. 90% of thyroid disease in America is due to Hashimoto's, and in this case, iodine can aggravate that. So if you have Hashimoto's, you want to be really careful. It's not so easy to get a good test for iodine, but the best thing is to, on the safe side, if you have a Hashimoto's, not take iodine supplements or just a low level, and it's probably safer to take if you do not have Hashimoto's related hypothyroidism. But the best thing is to test. Carnitine is important in mitochondrial function or energy production, and hypothyroidism can decrease tissue levels of carnitine, and this can contribute to muscle fatigue. And so this could be one reason why muscle fatigue is a symptom actually of hypothyroidism. And I've seen this in cases where this kind of unexplained vague muscle pain in people that have hypothyroidism, and it's undiagnosed by the doctors, and the patient continues to suffer with that. Lipoic acid is an important protector of the thyroid from oxidative stress, and it helps to produce glutathione. It's important for protection, and this can be low with hypothyroidism. Choline is important for brain function, and hypothyroidism can negatively affect its function in the brain, and this can affect your mood and cognition. So we know that mood disorders and depression can be linked to hypothyroidism, and this is one mechanism that may be contributing. And the last one I want to talk about is glutathione. Glutathione is the body's master antioxidant. It's considered body armor. And this is often found to be deficient with people that have autoimmune diseases. And there's some evidence that low levels of glutathione are really predisposing you or make you vulnerable to immune dysregulation and autoimmune disease. So this is an important one, and can be an important one to supplement to regulate your immune system if you do have Hashimoto's. And all of these vitamins can be assessed through testing. We can do cell testing for these. And so if you have hypothyroidism, it's a good idea to look at what are the possible nutrient impacts, or what are the missing nutrients that may be contributing. It may be difficult to recover if you're not addressing nutrient deficiencies. One chart I just want you to look at, and this comes from the Institute of Functional Medicine, really talks about the nutrients that affect thyroid function, but also negative things that affect thyroid hormone production. So if we look over here, we can see factors that contribute to proper production of thyroid hormones. We didn't really talk about iron and tyrosine, but we talked about many of the others. And we talked about here conversion of T4 to T3. So your body uses T3, but your thyroid produces T4, and that has to be converted in the liver and the gut. And these nutrients, these minerals are important for that. And you can see here that if you have stress, trauma, low-calorie diet, almost like a very low-carb or like a very strict Atkins type diet, that can decrease your levels of T3, and for women that can cause things like amenorrhea. So these are things that can actually affect your body's ability to produce the correct form of the hormone T3. And then finally we see vitamin A and zinc are also necessary for your cells to actually receive the hormone. So I hope that helps. I hope that's some good information for you. If you'd like to discuss your case or have any questions, we can help you. Look us up at fhainstitute.com or give us a call. And thank you for watching.